Sorry.
Yeah.
I just want to verify, literally,
Okay,
no.
that's the part. No, I don't. Oh, no.
We've got texture, we've got color, we've got occlusion, we've got contrast, we have a lot of challenges. One of the biggest challenges, and the ones that I hope to help with tonight, is how to take an accurate and consistent shade. And really we're going to do this with a system that's going to give you consistency and accuracy. And that's the 3D master system. Really to focus on tonight are the terms systematic assessment. It's clinically relevant to what we're doing, and it's based on scientific evidence, not just anecdotal. My sales rep said this patient worked this way. It's a tool we use to take shades, whether we use Renstrom Lab, whether we use Vita porcelains, whether we use an unusual shade guide. We all use one tool, and that's our eye. Unfortunately, that's the weak link in the chain.
Nick was one of our last hours. Kind of got me into it. And
With dental school, it's actually 14 to 15 times more sensitive to black and white variations. And you tell people that, and they often say, "But it seems odd to me because we shop for color." So 3 steps: value, chroma, and hue. Think about if you have difficulty seeing something, whether it be matching a shade for crown and bridge or seeing print on a text. What do we all do? We squint, right? And what are we doing when we squinting? We're negating the color receptors.
That's what I see.
The reason I show the guy like this is for most of the offices or people with inventions, you find the guy who
Got in between a 1 and a 2.
Well,
that's what I got.
That's what I got too. Just shout out what you think. Good, light, dark. What you think? Too light. You can see it, can't you? Okay, let's try the next. Here's number 2.
Dark.
Too dark? Yeah. Okay. Those 3 crowns are all half of value apart. So I show you that example to emphasize that it's really not color. It's not hue we're looking at. It's black and white levels. It's value. Most patients are going to be 2M1, 3M1, 2M2. You're going to capture, our studies have shown that 93% of the patients are captured in the M groups. It's called the Munsell color system, and this is really the foundation for our 3D shade guide. So it's really based around hue and chroma, not so much value. So even though we have 16 teeth or 16 colors or shades, or you might say 16 words to describe a patient's tooth color, we really only have 13. Now since then, evidence-based dentistry tells us there's a better way.
It's what's the catch? What's next? No, you're done. A lot of the times if you take a shit on the average type patient, there's always exceptions where you're going to fine tune it big time. But there are times where it could be that quick. A value, no, darker, 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 okay, no, right there. Okay, what's my saturation? Now when it is orange, it's not reddish or yellowish, you're done.
3D, you should probably guess, is for the 3 dimensions of color: value, chroma, and hue. Let's make it scientifically based and evidence-based, as we've talked about.
And literally, that number you give them, that tells the lab a lot. I mean, we've got different nomenclature here, but first number is the value group. And remember, that's which one of these groups am I in? It could be 1, 1.5, 2, 2.5, 3, 3.5, 4, 4.5, 5. Most of the time, it's what are the numbers? They know the value.
17% of the time, crowns came back from the laboratory, went back to the laboratory rather, for adjustments in shade. That's 1 out of 6 crowns. That's a pretty good chunk of time. Time is money, both yours and the laboratories. When the 3D master system was used as the platform, though, that number was reduced down to virtually nothing. 1% needed correction. I find if you start the darkest group, if you don't mind taking extra time, it's the best way to get your patients on your side. And move down until you find the tab that you feel most closely matches just the value or light and dark level of their tooth. Now let's say we get down to 2. 2 seems a little bit too light, so let's go back to the 3 group. No, 3 seems a little dark, and you can't decide between 2 and 3. What will we select, doctor? 2.5. 2.5, correct. Halfway is roughly what our eyes can see the difference in, so we can do a 2.5. The technicians at Randy's lab can make a 2.5. It's very easy. Our system is set up to support that. And I'm really happy to say they use the Vita porcelain, so it's really easy for them to mix it and make it out. Not all laboratories can do that, so I'll tell you, you're working with some pretty good folks here. They can turn out some fine work. So 2.5 is your value group.
Yeah, I think we're done with the classification. I've done that.
It's the one that's running last
You know what I mean? So then,
work.
especially with
Well, you know what?
the, I think you're
That's fine.
I think you're
Whatever you're